Hello everyone, it's Ashley with Amare for this week's Little Talk series. So let's talk about plastic surgery. Primarily what we do at Amare is plastic surgery recovery. That's pretty much all we do. We do have our holistic clinic that manages fibromyalgia, MS, autoimmune diseases, cancer recovery, all of those things. And we do use manual lymph drainage to help those as well. That's going to be a different video. Today we're going to talk about plastic surgery. So what we do is the ugly side of plastic surgery, the stuff that no one wants to talk about, the stuff that no one sees. So what does that mean? Think about when you have any kind of surgery, knee surgery, joint surgery, even just getting stitches, something simple, right? Well, we gotta go through this whole healing phase, and it doesn't look like a pretty thin scar. Sometimes it never gets to that point. With plastic surgery, it's meant to be pretty. It's meant to be aesthetically pleasing. But the whole recovery process is not that. It can be very daunting. There's something called the post-op blues that most people go through, which is basically where you get really sad and really upset and really depressed, and you think, oh, why did I do this? I'm so swollen, I look so ugly, it looks worse than it did before, because we're so heavily focused on the aesthetics of the plastic surgery. But you gotta go through the healing process, and it's kind of messy sometimes, and like I said, it's ugly. So a lot of what we deal with is people who come in that are swollen, as everybody is after surgery, that don't have proper garments, don't have proper foams, don't have the assistance or the post-op care. They go to see their doctor for their checkups, but they have the scary word fibrosis, which is basically your lymph fluid getting hard and stagnant, trying to create like an internal scab to help you heal, except it's too much. So basically, if you've ever like put spackle on a wall and you put too much, it looks really like lumpy over the wall, and then you gotta smooth it out and sand it down. It's kind of what we're doing with MLD. With manual lymph drainage, we're getting your body to drain all of the excess fluid it doesn't need. So getting rid of that excess spackle is what we're doing. So when you have a proper garment, when you got proper foams, when you have a proper lymphatic drainage therapist, you have someone to kind of guide you to do things that are lymphatically correct, it's not as bad. And you fly through recovery, it's maybe a month, month and a half, depending on how much surgery you've had. And then the rest of it from there is just your body healing, getting back to normal, retaining your results. That's your 1 to 3 month healing process. Your 6 month to 8 month to a year daunting healing process, you're probably not getting regular lymph drainage. You probably don't have a proper garment. You got really bad fibrosis you're not taking care of. You're definitely having salt. You're not having enough water. There are tons of things that goes into post-op recovery. So there are a lot of mistakes that can be made, but there are also a lot of things that can go right if we're doing it right. So one of the things that I came here to talk about today is the ugly side of plastic surgery, and it's okay. It's allowed to be ugly. Like I said, when you get stitches at first, it looks kind of ugly. Sometimes it, may leak or something like that, like regular stitches. It's going to scab up a little bit. It's going to look super swollen. It might look a little red. God forbid there's an infection or something like that. That's worst case scenario. Best case scenario, it's like 2 or 3 stitches and that's it. You got a little cut or something and you're good. But anybody who's had knee surgery, joint surgery, any major surgery, getting your appendix removed, gallbladder, tonsils, anything like that, it can be a little rough with the recovery. So at Amare, we deal with the ugly. All of our clients come into us and they're upset and they don't like our results and they're in pain, or they look great but they don't feel normal. One of the number one things that I hear is, I look great, my results look great, I'm super happy, but I still can't bend over, and it's been 8 weeks, it's been 2 months, it's been 7 months, and I still can't bend over, or my skin is super hard, or I have all of these fibrotic, thick balls or lumps all over my stomach and it doesn't look well. So there are a lot of things, and we're doing this and we're going through this and we're having this plastic surgery for aesthetically pleasing reasons. So we want to get to that end result. We want to get to that pretty looking thing. But the only way to do that is to go through all of the healing. So there are a lot of people that won't have garments, like I said, or won't have MLD, like I said, and they never go through the healing. Their body just kind of stops right there. And it takes 6 to 8 months to a year for their body to kind of be a little bit more normal, but even still, it doesn't quite look right. What we do is we make it look right. We pull out every stop. We do nutrition, we do garments, we do foams, we do anything that you need possibly as far as tools, but it's okay for it to look a little messy. It's okay for it not to look great. When you get a tattoo at first, the first couple days looks kind of rough. You don't really want to be taking pictures of it. And that also happens with plastic surgery. You'll see tons of people with their before and after pics right after surgery, like with a BBL or with Lipo, where they look super, super tiny all at once, or their BBL looks great, but then you don't hear anything from them for the next like 6 to 8 weeks. because it's a really not pretty process, guys. It's not that simple. So it's really important to have someone who's on your side. So even if it's just somebody to explain to you like what the process is supposed to be like, every surgery is different. Everybody's body is different. Everybody's journey is going to be different. We're all doing this for different reasons. We're all doing this for bettering ourselves, for self-care, for self-love, and part of that is your recovery. If you're beating up your body, if you're having salt, if you're having alcohol, if you're not wearing your garment, if you're not really taking it seriously after surgery, it's not really going to end well, guys. So we want to make sure that we're doing all the right things. Now, there's the other end of that where our doctors are kind of like, all right, you look good. You're fine. And you're like, I don't feel fine. This doesn't look good. I don't think this is okay. That's usually when everybody comes in for lymph drainage. That's the time when we get all the calls 5, 6, 8 weeks after when they're like, yeah, my doctor said I'm fine. I went in for my follow-up. I don't know, it just doesn't look right. Or a lot of wonderful doctors will tell you, you just had your drains out. You should go get lymph drainage. It'll take down your swelling. It'll make your scar look better. We do a lot with scars. A lot of times you'll have a tummy tuck scar and you'll get the dog ears back around the tummy tuck scar because that's fluid that's pooling there. We can target that with a proper garment. We can target that with proper foams. A lot of times when you have a tummy tuck, you've got drains. Once those drains come out, then you can be put in a regular garment. The white stretchy thing that kind of just is like elastic and wraps around you, like with your drains hanging out, that's a binder. That's not a garment. That's not a full body compression medical grade garment that's cut for your surgery. It's kind of just an elastic binder to put around you for compression for the time being. Once you get your drains out, we can get you in a regular garment that'll give you full compression and help your body come down in the places where it's got excess fluid. So there's a lot that goes into this, and everybody's body is different, everybody's surgery is different, everybody's results are different. But even a year post-op, even 2 years post-op, if you still have swelling, if you're still having problems, we can still help. Because your body kind of just took a pause on its healing. It didn't really have anywhere else to go. It had nowhere to guide the fluid to. It wasn't in a proper garment or whatever the situation is. We can always make it better and we can always fix it. It's the wonderful thing about post-op recovery is that it's a journey and you have to go through it. And the more serious you are about it, the less messy it's going to be, the less time it's going to take. So I highly suggest finding a professional, somebody who does real manual lymph drainage, hands-on manual lymph drainage that looks like this, that is very, very gentle, very soft, very light lymph drainage, that is not the craziness of cutting open your incisions or blood and fluid coming out of you, which, by the way, does not affect your swelling at all and does not affect your lymph fluid at all. That has nothing to do with it. All that does is prevent seromas. All that does is prevent your body from having all of that excess extreme fluid right after surgery. After your incisions have closed, that no longer does anything for your body. And if your doctor chooses to leave your incisions open, it's for that natural process to happen. But if they're closed and somebody comes at you with a needle to aspirate, there's nothing to aspirate. It's not a seroma. It's not like that. Your body and your tissue just has fluid that's leaked out in that interstitial area. So it's not really going to do much. It's probably going to cause you more pain because that area is really tender to begin with. So every doctor's different. Every surgery is different. There are reasons that we work directly with your doctor and talk with your doctor and don't just go doing all kinds of crazy stuff. So lymph drainage should be working with your surgery, not going against. It shouldn't be, again, syringes or cutting open your incisions or hard, deep pressure or any of the craziness that you see these girls go through post-op. If you have to take painkillers to go to a post-op appointment, you're going to the wrong people. It shouldn't be that hard. It also shouldn't hurt because that's going to ruin your results, and that's also going to create more scar tissue. Again, if you had a knee surgery or if you got a cut on your hand and it had stitches, and 2 weeks later or a week later or even 24 hours later you have somebody come and take their thumb and ride it against those incisions and those stitches, it's gonna cause more damage. Your body is the same way. Even though it's an elective surgery, it's still surgery. You still have all of this healing that needs to happen. So at Amare, we try to be the bridge from like that ugly phase to your results. And we get there pretty quick. Sometimes in 8 days, sometimes in 2 weeks, depending on how the healing process is. Sometimes it may take 2 months if you've been out of your garment for a year post-op with no care and you really need that long. But whatever it is, that healing path is still healing, and you guys have to realize that it's not just going to be a magic quick fix out of nowhere. I look great. You gotta take care of your body. Be good to it, and it'll be good to you. So at Amare, we are the bridge between the medical and the holistic. We try to keep it in a balance, but again, you still have to go off of what your doctor says. You still have to play by the rules of healing. You can't skirt around it. Have alcohol. I know it's summer. We want to be on the beach. We want to be out. We want to show off our results, but in the long run, it's not going to be good for your results if you're not doing all of the post-op care. So it's not just lymph drainage, and it's not just wearing your garment. You have to treat this like a real clinical surgery, like you just got a knee replacement or something. And the more that you do that, the quicker and faster you're going to heal, and the better it's going to be for your results, and you're going to look amazing. So take a little word of advice, take it slow, make sure that you research what you're doing beforehand, and that is how we treat our patients, and our surgery is in a very healing, loving, gentle way. It should be a full body process. It should be a full-on transformation as we want it to be. So that is all I have to say today about that. We do tons of plastic surgery, breast augmentations, implants, BBLs, mommy makeovers, tummy tucks, lipo of all kinds. We do garment fittings. We can help you get a garment if you need one within like 2 to 3 days. We do scar, lightening / removal, smoothing them out, making them pretty seamless. So let us know if you need anything. DM us as always. I hope this helped some of you guys in the post-op world. I hope this also gave you a little bit of insight as to what plastic surgery recovery actually is and why it's so important. We will be doing a YouTube video on it soon as well. Check out our YouTube channel, Amare Healing Arts. Also check out our website. All the links are in our bio in the link tree. Check out our blogs. They also give you more information on specific surgery recovery topics. And let us know if you need anything as always. Thank you for watching. Thank you for joining in today and this week, and I hope to see you guys soon. Bye.